No, because my very first shift in med-surg was on my very first nursing contract, which is what I'm on right now. It was on a very random day. They were just like, hey, you're floating to the floor. Okay. I've never been to this floor. I've never seen this floor. I don't know anyone. I don't have access to any of the doors or pics. I don't know anything. And they're like, hi, here are your two patients. I'm like, I don't even know where these rooms are. Like, so that's just setting the scene of like how crazy this night was going to be. And I was open for an admission, don't worry. And I did get set admission. As soon as I'm done getting report, as soon as I'm done and day shift leaves, my first patient goes into AFib with RVR. Heart rates get as high as 170. And that I'm looking at the patient, I'm paging the doctor, which I haven't had to do in so long because in the ICU, the doctors are right there. Like in the ICU, someone would already be overriding metoprolol because the doctors are at the bedside giving orders because they're just literally a shout away. It's like that. So I'm paging the doctor. I'm waiting on the call. The tele nurse is blowing me up. Heart rate 130, heart rate 140, heart rate. I know. I'm looking right at the patient. The doctor finally calls me and they're like, okay, we're going to give metoprolol. Duh. Do you feel comfortable pushing it? And I'm like, yeah. And he's like, okay, go ahead. And I'm like, okay, thanks. Mind you, I still don't have access to the Pyxis, so I'm talking to the charge nurse and I'm telling her what's going on. Tele nurse is like, we don't do that here. We have the doctor push the first dose of metoprolol. And I'm like, I had no idea. I literally had no clue. So then they're like, okay, well, since you're an ICU nurse, like you have the credentials, we'll let you do it. Okay. I'm handling that situation, like busy starts to the shift. I'm handling it simultaneously. My other patient who had just completed his CWA protocol, they don't think they're going through withdrawals anymore. They think they're just delirious. This patient is trying to get out of bed. They're just going crazy. They're in 4-point restraints. They're taking their condom cap off. They're swinging it. They have a sitter. Like, I don't have any PRNs. I have nothing to give this patient. Nothing. I'm like, what am I supposed to do? Like, I'm paging another doctor. Like, help. Like, please let me get something. And they're like, yeah. I'm trying to calm them down. While my other patient's heart rate goes back to 140 sustained, now maps are in the 60s. Paging the doctor, telesitter, blowing me up again. I'm like, yeah, his heart rate's high, but now his map is in the 60s. She's like, oh, we don't go by maps here. And I'm like, okay, well, his blood pressure is low. His blood pressure is low, okay? Okay? And I got an admission. So, like, med-surg, not for me. Not for me.